society to ensure conditions next years. Well, almost always. She got a bottle of water. She gave me a pitcher of water. And I said, I basically, I really want to see. I'm never bothering water. Brains right up there.
Right, yeah.
Started with Edward Snow. Yeah. So she's. Thank you. Next time, save the water.
Right, fill up in the water, yeah.
Just.
Like irrigation, yeah. Right. Yeah. The drink of water here.
Something that.
Thanks for coming.
I share this about.
It's not necessary.
Some sort of like online campaign. But I don't understand. I can drink water out of the house.
Sure.
So when I came here, I was like, that has to be safer than what I would. So I never bought.
Exactly. Well, and it isn't popular, it usually goes in popular. Just.
I agree.
And actually, I did some studies. She's been. Because there was, we're gonna do that. We are outside. Give her a shit. Your essentially organization concerns in this country and people that have said the president.
We'll see, hopefully the rest of your day is good now, no matter what else happens.
I think it's also giving people a little bit more information of how the water's treated, it's like what is in the water and why it's safe. And no need to buy or send it to me in the plastic, the recycling part of it. They can come up with a little campaign. They have some campaigns down in like Mexico and Latin America. They show like depending on the area, how safe the water is. If you're in this area, this is what you should do. And then they give it like how to sterilize the water, sure, boiling and all that. So depending on the area,
Right.
so they tell us how the water's treated, how safe or not.
It's just, all right. Well, especially now with summer. It's just like,
Yeah.
Yes.
I'll have to talk, I can talk to Russ. All right, now I'm
Guys, laugh it, let me know if I can.
I'm gonna bring it up, I'm
Anyway.
gonna bring it up for board. Right, that's gonna be somewhere. But I just. That's all. You asked for it, they bring you just a glass. Picture, like,
All of it, all
it's
these
not a
are.
picture, it's like 20 pieces of wrap.
Yeah.
It's about this tall.
Yeah, just get that. Oh, God. No.
So,
That's a good question. I like to use this.
and it was, that's not funny.
Just think about
We're nice and cozy in here.
I know, actually, I was pleased to be able to come here. It took 10 minutes
I agree.
driving time.
Oh.
How many responses you get? Did you get everybody's
Wade is coming.
I hope they didn't go downtown.
Yeah. I was gonna say, they said they were coming, Best Eastern and McNally said they were not. And I believe, Becky said she was not, so.
July. Here is the July meeting. I think I'm gonna be in. In July, I will be in Stanford
Where?
for 3 weeks. Ghana, Togo, and Benin.
And you're going with a group?
Yes. Traveling.
It's just a.
Like a medical mission trip.
Oh, wow.
Yeah.
Oh, so would you actually doing some work?
Yes. We have a team of 5 doctors. Mostly GYN and general surgery.
So.
And I've done medical mission trips to Mexico and South here, but never across the, so I'm excited. This is the first time I actually traveled, outside of Mexico, the United States.
Oh, gosh. Oh, interesting. Hearing some
Sorry about the water now.
Well, exactly.
I have to go next week to get all that.
I was just gonna say, yes, so malaria.
Yellow fever. And I have most of those because of the medical
Right,
route,
right.
but yellow fever, malaria.
Right.
We'll see.
And when, this is July.
July, so we travel July 13th to August 1st.
3 different countries.
It's so interesting to try to process all the visas.
Oh, okay, so not only passport, required visas from.
They headed to the LC, so Two of them went to the legislative change. So wait on them.
Some of them went the wrong way.
They went downtown.
Even though I told them.
Exactly. Exactly. You know, when I was driving here, I said. Who was Wade? Is John one of them?
The only two people were missing that said
Yeah,
that they
Jane.
were coming late and.
And Jeannie?
Both of them. Yeah, both of them are down.
Jeannie missed it.
Yeah, both of them are down.
Jeannie's the secretary.
Yeah, she said John and I have been to.
She didn't read the small print.
In fact, I even brought that up at the last board meeting. I said something about, wow, we're meeting up here.
And I'm
didn't I?
not sure that when I sent out the.
Right.
Agenda, did
I
I?
remember saying that. I was commenting, oh, we're
It
gonna
happens,
be.
your body just, the mind takes you.
Yeah, I should have probably had this session or I just called him.
Okay.
Because, Dr. McNally, he had known that it was today. But on his calendar at work, it was his schedule for next week, so he had scheduled one of the meetings.
Well.
Heather, we're in this subject. I'm not gonna be here for the next meeting. Mark me out, mark me out. I'll be far, far away.
Far, far away and Troy, the wild
The first time, so I'll report back.
Okay.
There's one behind that. Yes. 8:35, 8:37.
Say we don't have to worry about parking. Not worried. So that. They'll have to pay themselves. Going up to Chris's office. Get out of jail.
I've done that before where I have driven to the wrong hospital. But she was very clear. I saw it on email like 2 or 3 times. So that helped me because that's
we
stuff.
mentioned it.
Yeah.
But, oh, well, I don't know. I think they're on the
You know, going back to water, I've noticed in a lot of the big cities, they actually have a lot of the different stations where you can fill up water outside in areas where like parks.
Right.
How can we have that many here in,
Not that many, but there's one down in Junior Mall.
Yeah, yes, yes.
And by the restrooms.
Yeah.
Art, what about?
We go walk, get out of my office and go walking around. Yeah. Yeah.
You're right.
Because there's like a lot of public areas, even like, big cities where you actually, like subway or places like that, they're everywhere where you can fill up water bottles.
Exactly.
Bus station.
Seems like probably not so much here, like grocery stores, I'm thinking of, like stores like retail outlets, probably do not.
Right.
But anyways.
I was thinking like Target and Walmart, as I was seeing in there too, yeah.
So. The science is what's the name now? What's the current name of the municipal?
Oh,
Schwab, is it now Schwab? Hey, Chris, what's the name of the baseball field now that's College World Series? Who owns it? What's it called?
Swap. Well, TV Managers and Boston.
Merit trade.
Swap.
Schwab is now Schwab.
Wonder if they did.
Let's see. I mean, it really was like.
Once I went to Austin, it was so hot that they said.
If something happened, it's really up.
Water.
He brought it up to me.
And it didn't work.
So anybody is
That was where it was her.
It's the Schwab.
Oh, okay.
Total series, yeah, so it's like 100.
Anyway, this is basically.
It usually right now.
Right.
But
It's like.
Set up here, what, how they set up for you.
They
Right.
They would look at temperature.
They were also relying on free possible area.
I can, yes, I can, so,
Yeah.
an hour.
So when you put it down, it's all that. So,
I'm going next week, so.
is the agreement, no agreement, that's 5:30, the takes.
The amount.
What's the wage and
The big. That's what I see. Yeah, I'm not sure. I'm gonna go to Baker's. Okay, I have a thing. The campaigns to, reduce the consumption of water. And especially people buying water in grocery stores. Number one. When their resources are reported, that's what I'm saying. We need here.
Nice.
Exactly. And the plastic. It's just like, how about us, I'll talk to somebody in environmental, but a campaign, it could be even a couple of radio, public service announcements or something. Something, yeah, to just. And also to Sienna Water continue that and.
All right. Okay, we ready?
I'm gonna bring it up with the meeting. We can brainstorm for a couple.
Glad you found it.
Little embarrassed, are you?
Okay. Good morning, you all. Let's be, we'll be official here. At 8:45, we will call the June Board of Health meeting to order. There is a copy of the Open Meetings Act over there on the south wall, if anybody knows it for official record. And with that, we will have roll call.
Wade,
Here.
Festerson, McNally, Rogers.
Here.
Dees. Here. Jones. Wilken,
Here.
King. Espinoza.
Here.
Item 2 is approval of the minutes. Is there a motion to approve May minutes of the Board of Health?
So moved.
Second.
Motion, by Wade, second by Wilken.
Wilken,
Yes.
Wade,
Yes.
Rogers,
Yes.
King, Jones, Reese. Yes. McNally, Espinoza.
Yes.
Festerson.
Item 3 is the approval of the action items A through J. Is there a motion to approve? Motion by Weiss, a second.
Second.
Second by Wilken.
For the motion.
Weiss, second by
Thank
Wilken.
you.
Is there so let me ask a question for 2 of these particularly. E and F, those are the CDC grants. Is this the infrastructure grant?
Yes, it is.
Okay. Cool. So I'm just curious, what happens after the 5 months, the agreement from June to November? What happens after that?
So,
And define infrastructure.
sure. So these are paid out of the CDC Public Health Infrastructure Grant. It is a 5-year grant. We have already received expanded authority to spend, to cross over 2 budget periods for the purpose of this. So these contracts will cross over into the new budget period, but we already have accounted for that and have carryover authority.
So, what did we get this in 22?
We did.
You
We got
didn't
this in
go back and
22 and
spend
it'll extend through 27.
It was it 22 to 25 and you got some additional years to spend it? Or explain to me the term you just used by extending.
So because most of the grant recipients had some difficulty in executing contracts and getting things rolling right off of the bat, the federal government recognized that and granted all recipients expanded authority. So basically they allowed for us to carry over the funds into following budget periods,
Okay.
into the new years,
Okay.
without needing to file budget amendments. So as long as the activities that were originally approved within our approved grant budget are continued,
Yeah.
we can continue into new budget years without needing to file for an extension.
So is the June to November timeframe got something to do with the federal budget year being October?
So this grant's budget year is December through November. So the grant budget
December
period
through November.
ends at the end of November, so that's why November was.
So what is this just, what are we giving them the 100 and the 25 for? I just want to explain this because
Yeah,
it seems like, I'm trying to understand what we're setting up and trying to get a picture of how it continues. So
Sure.
what is the,
So-
you're giving them 100 to refer people to family housing?
Yeah.
Do what?
so the infrastructure grant is divided into 3 components. There's the workforce component, which is the largest funded component. The second component is foundational capabilities, so us maintaining those essential services necessary for meeting the needs of our community as it relates to public health. These contracts are funded out of that second component, that was foundational capabilities. We recognize that a local health department, you know, our need to meet the unique needs of the community require us to establish and maintain relationships with community partners. We also recognize that those social determinants of health, like housing, are direct drivers of positive health outcomes. And so we feel very strongly that we need to support those entities within our community that are addressing and meeting those unmet needs. So these funds will not directly support rental assistance programs
So
or
we
pay rent.
buying family houses, time and expertise.
We are partnering with family housing to make sure that we are supporting coordinated referral to needed services for eligible recipients within the community.
Yeah, so are we buying like community health, we're buying, there's $100,000 buying their time. So when a community health worker refers, they'll work on it.
I don't know if I would characterize it as buying their time. I would
Okay.
say that we recognize that they have a need for additional financial support to be able to maintain the services that they offer. And we recognize that, you know, we can continue to support referring people into those services and then make sure we can provide some loop closing to make sure that those services are meeting the needs of the community.
So it's not a direct time, but by having a contract, they're gonna understand that they're gonna be reversed for a
Yes.
social community health.
Yes.
So the contract with Whisper Roots is not buying food, it's buying the connection to
Yes.
help them make it. Okay. So I might have missed it. Did some other ones come through on the last one? So that's food, that's housing. What about the workforce? Money will take care of the economic workforce stuff of the social term.
Yeah,
Okay.
I mean, there are a number of relationships that
contracts
are
with each
connected. We don't have
Okay.
contracts for each of the social determinants.
Okay.
It's possible that as we continue to move through, we may identify other relationships that we want to continue to support through contract. We've not done that so far.
Okay, so my last question. So is family housing expected to keep us in the loop on stuff they
Yes.
do with how, okay, that they do?
Yes.
Okay.
Chris, I have one question. So there's a section in that agreement that talks about Douglas County doing inspections for the state, that they would need to do like outside of Phoenix County. And that we get paid by the state for those inspections. And it says if there's money in the fund, something, if there's money in the pool, is that ever not, have we ever not been paid? Like, is there? Anybody know? That's kind of like natural. Or something like that.
Not in the time that I have been here, to find out beyond that, I can ask some questions and get back to you. I don't,
Again,
yeah,
I think the state's probably always good.
they've always been pretty good about giving us the money, so they don't, you know, they have to inspect everybody else who doesn't have that kind of a program in the community, and so I think they're very happy to have some help.
It's just one of those things that's like, well, they'll be paid if there's money.
Yeah.
And that's kind of not-
Yeah, it hasn't come up in the last 3 years. I haven't heard that it was a problem before that either, but I can answer them.
Jamin, I just have one quick question for you. When you were explaining to us, the three different functions of the infrastructure bill,
Yes.
you said the first was workforce,
Mhm.
the second was foundational capabilities, which are, what was the third?
The third is data modernization.
Thank
Yes,
you.
and so we were not directly funded for data modernization. Actually, very few applicants were. We have been told that we can utilize our foundational capabilities dollars for data modernization if we choose to. But that is the third.
David, hold up, I got it. The social determinant health screening tool,
Yes.
is that the same one they use in the hospital?
No, so, and I can get back to you with more information. My understanding is, our community health workers and our health promotion team developed sort of an in-house social determinant screener that they are utilizing to identify those needs and help to connect and refer people into service and support.
All right, there's a motion second. You need,
And just as a quick side note, since we are working on limited microphone work, which is what's up here on the podium, can we make sure that when we're speaking up, we're
Got
enunciating it and a little bit louder than normal? I apologize, people on Zoom are kind of going, it's muffled, so. But that being said, Rogers,
yes,
Logan,
Yes.
King, Jones, Espinoza,
Yes.
Weiss,
Yes.
Wade,
Yes.
Festerson, McNally.
all right, let's go to item 4 in the health director's report. News.
I'm gonna try real hard not to pass out sheets.
Yeah.
It's good to have those.
All right, well, good morning, everyone.
Good morning.
Welcome to our a little bit warm room. I do have a few updates for you and also some honors to give today. I'd just like to start out with a few of updates about the building here, which sitting in this hot room, you might be kind of interested in hearing. We are working on adding some additional fob readers to our building. So currently we have keypads on some doors, we have fob openers on other doors. The keypads have to be, changed if we terminate an individual. Common practice is to change the locks essentially. And it costs quite a bit of money every time we have to change the code on that. And so we're just updating, kind of our access here and putting in some fob readers. We are also exploring utilizing 24-hour monitoring with those new cameras that we've put on the building. So you've heard a lot about the Verkada system that we put in. It does have the ability to interface with those fob readers and actually tell us who has scanned in and at when. And so we can kind of track that a little bit better. And also it would provide us 24-hour monitoring for basically building access, which we think is an important safety feature. So we're working on that. We are having a number of issues with the building. First and foremost, as you sit here, we do not have the HVAC working in this particular room right now. They've been working on it for a couple days, and unfortunately the compressor won't be in for a while. So you get what you get. We also are experiencing some other issues that we're working with properties on. You might have noticed when you came in, we have a number of cracked sidewalks outside right now that present a tripping risk, especially for our clientele that might be coming in. And so we need to get those fixed. I don't think any of you came in the south entrance, but if you walk under the big blue awning, you're going to notice a lot of birds. We have tried one solution so far that does not appear to be working well. It was an odor, basically releaser. It releases a grape odor that birds are supposed to hate. It seems to be attracting them. So we're going to continue working on that as well. It does present kind of besides the fact that it's unnerving to have birds diving at your head, it does create quite a mess where our employees need to be walking into the building. We also continue to have issues in our east parking lot. So that's the lower lot where our staff typically park. That's kind of around the corner from the top lot here. And there is basically the grate that goes across the middle of the parking lot to drain down the hill has come loose, and it has actually popped up and hit a car on a couple of occasions. We've been waiting for that to be fixed for a while now, and I am not 100% sure on what the holdup is with that. But it is something that is certainly concerning for us, and it does, just the way it sits, does also pose a bit of a tripping hazard. There's a number of cracks and potholes back there as well that need to be repaired. So those are some concerns that we have about the building currently. There are some others internally. Those are the big ones that I have at the moment. If anyone's interested in walking around to look at any of those, I will be available after the meeting. I want to give a quick kudos to Jerry McKay for all of her very hard work on all of those building issues that I just mentioned. So she is really on top of things and has been working really, really closely with properties to try and get some of these things resolved. And I know that that's in addition to the other work that she does with our, managing our budget office. So we're just really grateful for her and the hard work that she puts in. Speaking of Jerry and the budget office, we will have a budget update for you for next month's meeting. We're still finalizing numbers for this fiscal year. Fiscal year goes through June 30th. So technically it's not all the way complete yet, even though all of our requisitions and everything have been submitted. So we will make sure that you have a final wrap up next month on our budget. I also want to throw out a kudos for our environmental health staff. It is summertime, which means that our staff downstairs are extremely busy. Our sanitation crew have been out doing pool inspections, and I know running to get those completed. And our environmental health staff have been extremely busy, or our food safety staff have been extremely busy with special events such as Taste of Omaha, the College World Series coming up. Anytime we have a special event like that in town where there will be food vendors, that means our inspectors have to go out and make sure that everything is safe and healthy for the public. So very grateful to them. And our air quality people, I suspect as the heat goes up and we have potential other issues in terms of fires and things like that, they're going to be kept pretty busy in the next couple months as well. Another environmental health update, we are working on permits for our really, really cool drone that we got. So a couple of our environmental health specialists were able to get their pilot's license. This is not like a little recreational drone. This thing looks like it could carry a kindergartner. It's huge. And the purpose of having that is really to enable us to more safely do things like drop larvicide around forested areas or wooded areas and over lakes and things like that. It can also assist us in seeing potential issues in terms of debris and things like that laying around that we might need to check from an environmental health standpoint. It just gives us a better vantage point in some instances. It takes a lot of permits and a lot of legal back and forth to be able to actually utilize one of that size. And so we are currently working on getting those permits done, and hopefully we'll be able to use that soon. Yeah.
Where are the drones housed?
They're in
Is that a secret?
I am actually not sure where they're keeping it. The people who are piloted are downstairs. I would imagine they're keeping it either in our locked storage area or in the warehouse just across the road there.
What's big?
What's that?
big? What's big? You say, what size?
Big. I have not personally seen it yet, but it is very large. I've seen pictures. I mean, it's a good size. You know, the drone itself isn't huge, but
Yeah.
then the wings and everything on it are quite large. Yeah. She says it will carry up to 55 pounds. So it's a pretty robust piece of equipment.
It's the first,
Probably not many, maybe a couple. You have one right now? Yep. Oh, lab, okay.
environmental services using.
Environmental health, yes. Our sanitation and vector control, essentially. So
So what about food inspections?
could we use it for pool inspections? Technically, yes.
I was curious how you analyze it for its future deal, because there's a Shamlaw is basically about to, the county's gonna pay from the upgrade. The contract with Esri to give you more things.
Okay,
So I know you all got a pool inspection thing going on.
we do.
With their drones. I'm just curious how much have you already analyzed what the potential is to do more with this infrastructure project, because there's a whole lot more that can be done.
You know, I don't think we have discussed that to that level. The use, I think right now, they've been pretty focused on just getting their licenses and getting the permits so that we can actually get it up into the air. We can't actually lift off without those permits. You have to have FAA clearance. Who knew? To do that. So certainly those are conversations we're very happy to have.
No. So much. I think
Yeah.
just with this whole social determinant of you want these drones, you do a whole lot of stuff.
Absolutely.
So I think somebody needs.
Right. Okay, a couple more announcements and honors. We do have one resignation to announce this month, and I'm very sad to announce it. Kurt Morrow is one of our emergency response coordinators, and he's here today, and you'll get to hear from him a little bit later. He has taken a job in North Carolina, and I'm very sad that he's going to go. Kurt is a planning mastermind and logistics whiz. He has been just an incredible asset to the department, and we're very sad to see him go, but we are also very happy for him to have the opportunity to grow and go on a new adventure with his family. So Kurt, thank you for everything that you've done for us, and we are going to miss you. Okay, we have one individual here today who is celebrating 25 years with the department. Sarah. Oh, so you're behind that.
That's right.
I'm not used to having the pillar in the room. If you'd like to come up, you may. So this is Sarah Hansen, and she has been with WIC here for 25 years, but she's been with WIC general longer than that. So she's an absolute pro. I think her whole career has been in WIC, is that right? So she started out at the Indian Chicano Health Center, and then she was with, which university system had it? Was it Creighton? Okay, so Creighton had the WIC kind of contract for Omaha before it came to us here at Douglas County, and Sarah came along when it transferred over to Douglas County Health Department, and she's been here ever since. She's an extremely hard worker and is said to be happy to jump in wherever she's needed. And she also is very supportive of her coworkers and also helping other people in the state learn and grow. She was able to attend a train the trainer at UC Davis and then come back and train other people across the state in healthy baby behaviors. And she just is a huge asset to WIC and to our department and ultimately to the community and the people that we serve. So thank you so much for everything you do. Thank you for 25 awesome years.
Right.
That is a really awesome accomplishment, and we're so honored that it was here. So
Yeah, I
thank
appreciate it,
you.
Come around to the front.
Oh, he wants to live out.
You wanna see it?
Yes.
There's a paper in there.
Oh,
so-
gotcha.
Thank you.
Thank you.
So Sarah, I'm just curious,
Yeah.
were you at 24th Street when it was before One World was your kind of work?
Yes, yep. I did my internship here long ago, and I had a contact with the health department in Wick, and
Uh-huh.
so they had a contract job open when it was Indian Chicano. It was first opened.
I mean, you were in a small place.
Yes.
Besides this room.
Yes, we had a WIC office there that had just opened, and I worked just a couple days a week, and then a full-time job came open at the old St. Joe a hospital, very small clinic with just 3 staff. And then the program grew and we moved out west, had our own clinic out there, and
So you followed the program?
Yes.
Jesus and you-
Yeah.
Okay.
yeah, so, yeah, it's been a while.
Thank you,
Yeah,
Sarah.
Thank you. Thank you.
All right, and that concludes my updates for June.
No, I just want this drone thing, I want y'all to think of it. I'm serious. This
Absolutely.
drone thing is.
I will get with Russ and we'll start doing some bigger thinking on it.
All right. So the presentations, are you introducing Greg?
I can try. I just met Greg today for the first time and I feel like I have a new best friend. So I am very happy to have Greg from Whispering Roots come present today. We have been partnering with Whispering Roots for some time. They were absolutely integral to the work that our navigators were able to do during COVID to make sure that people who were isolated or quarantined could get the nutrition that they needed. That was such a valuable, excuse me, that was such a valuable activity for us that we've continued working with them, and they partnered quite a lot with our community health workers to, again, assure that people are able to get what they need. So it's a wonderful partnership. We're really excited to have them come today to talk to you a little bit more about what they do. So great, thank you for coming.
Check this real quick. Well, thank you for that. I appreciate it. It's good to be here this morning. I tend to talk pretty quick. The organization does a lot of things. So in the next 3 hours that we have together, I hope to cover that. It's going to get about 15 minutes. I do want to come back to the drone piece. We'll cover that a little bit. But the organization Whisper Roots, we are a 501c3 nonprofit based out of Omaha. What I'm going to do is give a quick overview of kind of who we are so you get a good sense of the size of the organization, our structure, and then the work specifically that we've been doing with kind of health department. A little bit about my background. My degree is in MIS. I'm a computer guy. Did MIS and Met together in school. And then I was also a certified Navy supply logistics officer. So the work that we're talking about doing in terms of food logistics, moving food storage, aggregation, things like that. I studied and ran scenarios regarding national defense. So that's what we used to implement when we were working on the work for Omaha and building the facility that we have. That's my contact information. If you have any questions afterwards. What do we say we do at Whispering Roots? We say we grow, feed, and educate. We grow healthy food, feed hungry people, and educate communities and all types of things. It's everything from hands-on experiential learning with kiddos all the way up to health, culinary, nutrition work, a lot of strategic logistics work as well for a lot of organizations in the Omaha area. Some of the places that we work now, we were started out of Omaha. When I started, there was just me with a seedling tray and my RAV saying that we could change things in Omaha. That was back in July 2010. Back then I was running organizations, talent acquisition organizations for TD Ameritrade. I was head of talent acquisition for TD Ameritrade back then, before leaving to start what I thought would be a project that would last maybe 2 years, giving back to the community. The problem was so much bigger than I thought. It went from being a project to becoming a nonprofit, and that's how Whispering Roots was born. I did not intend on building a nonprofit when I left TD Ameritrade. I intended to go back into the corporate world. Never made it. But these are some of the places that we worked. We started in Omaha. Our first project was King Science Magnet Middle School in North Omaha. And then from there, we've grown into all these. We do both urban and rural work. And we also do some international work. Where else do we work? We work in Madagascar with the Indian Zoo. We work with those folks to teach them about aquaponics, hydroponics, things like that. I don't go to Madagascar. That's all funded by Madagascar Biodiversity Initiative. And then we also work in Haiti and the Central Plateau of Haiti. As you see, it's pretty dangerous over there right now. I haven't been back in a while, but the facilities that we built there are running. They're being run by people that have absolutely no formal education whatsoever. And that's how we designed them in case we couldn't get back in the country. And they're doing great. Some of our partners, one organization can't get this work done. It's very challenging to feed people. It's very challenging to move food. The last mile, the last inch food distribution piece that we talk about is very, very complicated. Our team works really hard to get it done. They make a very complicated activity look very easy, but it's not. And it takes all of these organizations, and this is just some of the people that we now partner with in order to take care of our clients. Now, there's a little bit of everybody, hospitals, nonprofits, churches, schools, you name it. Some of our strengths, what do? We're vertically integrated. We look at culinary, nutrition, education, logistics teams. We're successful with food aggregation and production. We do emergency food distribution throughout the community. We're doing a lot of work right now with the tornado issues, feeding people there. And then the piece that most folks don't even realize is STEM education. We do a ton of that. The organization started as a STEM organization, hands-on experiential learning with kids in schools and underserved communities that try and break the cycle. So when we're talking about the drones, we actually have drone programs for our kiddos, starting with micro drones, moving up to video drones, moving up to ag drones, building pipelines for kids to get into the drone environment. So that's something that we can talk about later as well, because we do that in schools. Our kiddos over at our Trinity Elementary they have all our programs, including drones. So that's something we can talk about. But so these are some of the pictures of some of the work that we've been doing on the left-hand side. That is a food distribution operation that we created in North Omaha during COVID. That started as an emergency food delivery that we were doing to a house. We found out that they had an empty lot next to that. We started building a community garden there. The people were so excited about what we were doing that we trained them then to become a food distribution network for Omaha, a site. We were dropping 10 to 15,000 pounds of emergency food during COVID. At the end of that driveway, we trained all of those people from the community to run it, and we were feeding people in North Omaha from the end of a driveway that started as emergency food distribution. One of our most successful operations there, and they were great. And then other things that we do, you see fresh food, salads, things like that, logistics. We need coolers, we need delivery trucks. We built all of that from scratch when COVID got started. We were a STEM organization until COVID got started, feeling that we might have problems with feeding people. I spun our organization into logistics, and we built it from scratch. And we borrowed places. We borrowed the CHI Center, the center picture in the middle and the bottom. That's actually CHI Center. We were using their facilities since no one was in there to start doing distribution. But you'll see, even Heartland Health and other folks, we were feeding all of them during COVID as well. Some of the other things that we look at, who do we feed? Seniors, homeless, immigrants, children, families, schools, daycares. We have them all. Starting with emergency food distribution, it's grown into all of this. When we first started our emergency food distribution, at the time we were doing what's called food pharmacy, using food as medicine. We were probably doing about 1,200 pounds or so of food a month. You'll see in our highlights, as last year, we were doing about 3 million pounds of food. Pre-COVID, about 1,200 a month. Last year, about 3 million pounds and growing. We have commercial kitchen facilities as well. When we talk about providing good quality food, that's another reason why we're very busy. We have our commercial kitchen off about 84th and now, right across where the new food bank is going to be going, right across the street from there. But we have commercial facilities where we take aggregated food and purchase food. We turn that into good quality restaurant grade meals. And then we send that back out into community, immigrant communities, homeless communities, emergency food deliveries. They also get fresh, prepared, healthy food. What do we have on staff? We have registered dietitians on staff, trained culinary chefs, and then we also have members of the staff who have master's degrees in public health. And so there's always a battle between our registered dietitian and our chef in terms of what's going into the meals. He says more cream and she says less, and then they battle. It's always fun. But the food is restaurant quality, and as a members of our team, we're also required to eat our own food. We will not distribute what we wouldn't eat ourselves. So the team eats the food that we create. We also do community farm stands. Some of you have seen that. North Omaha, we do neighborhoods, WIC, double up food bucks, tokens, vouchers. We utilize small and immigrant farmers as well, in addition to what we buy. But you'll see these at Highlander, you'll see these at WIC sites. We do pop-up food stands. We bring in all this good quality food. We provide them additional money and tokens and vouchers to double their money so that they can buy greater quality of greater amounts of high quality food. We say it's at the point of consumption. So we go where our clients are. And these are also tailored to the clients that we work with in the community. Some of our clients, of course, ESL, things like that, where English is a challenge, who might not be comfortable with going to some of the other farmers markets that are in the community, in the area. So we take it to them. We also bring translators in with us to make sure that the people in the community get what they need. Folks say that people don't want good quality fresh produce. That is not true in these underserved communities. They eat what they know, they eat what they have access to. When it was 110, 113 degrees last year, we were supposed to be having our farmers markets. We were thinking about canceling due to heat. They were calling us and telling us that people were already lining up in the heat, umbrellas and things like that. So we still came out. They beat us there. We're busy every year, and we continuously run out of funding every year because we're growing. But we're feeding them good quality food and economic development, because these are all local farmers that you see. All this built, like I said when I started, was a seedling tray and a RAV. We just opened this facility last year. It's a 26,000 square foot community food hub. It's right off of Highway 75 in Q, next to UPS, right in the middle of the Q Street redevelopment. 26,000 square feet of space. We do food aggregation, food distribution, food storage, coolers and freezers, nutrition education, economic development. Of course, out of South Omaha, we were in North Omaha, but we outgrew our site in North Omaha. We couldn't find a site that was big enough for us, so we had to move to South Omaha. But this facility has been instrumental in allowing us to expand the work that we're doing. And we're busy. We don't even have a sign on our building, and we stay busy. People find us. So. And the Omaha Housing Authority, that redevelopment that's literally 2 blocks from our front door. So you'll see people will be able to walk over. Simple Foundations, Catholic Charities is right up the street from us. We support both of those organizations as well. Logistics. More specifically about our food box program, this actually started during COVID, June 2020, before we knew how COVID was being spread and things like that. I'm a firm believer in don't put my people out doing something I wouldn't be able to do myself, or wouldn't be willing to do myself. Myself and my second in command were the first 2 original emergency food drivers for COVID, for myself and my second in command. We delivered the first vehicles before we had other drivers doing that. But we started COVID about June 2020, multiple items being delivered, food, sanitizer, masks, things like that. The good thing about the work that we do with Douglas County Health Department, our fantastic partner, is since we are also an aggregator, any food or anything that couldn't be covered, any gaps that were there, Western News could fill to make sure that the clients were receiving comprehensive packages. But that was a lifesaver program. Continues to be a lifesaving program. COVID quarantine, COVID positive, people who get out, people who get access to grocery stores, we fed them all during COVID. We started at 1,200 pounds before COVID, and now we're at 3.5 million plus a year. Referrals from navigators, partners, health organizations. We stood up a home delivery network with our own drivers so that we could do last inch deliveries. We were doing large distributions. We partnered with USDA with their food box program to bring those in, and we created this really large network that exists today, feeding people where they are. The current focus is shelf-stable items. One of our specialties is fresh produce, dairy, meats, things like that, and also now shelf-stable items. So as we partner with Douglas County Health from these distribution points that might not have cold storage on site, we can give them shelf-stable items that they can give to people that come in that are in need of help. The thing about what we did with these boxes, there are immigrant communities and everybody has different meal desires and things of that nature, different types of foods that they eat. I'm a firm believer that just because you're in need of food does not mean that you have to take what we give you. Food is a right, it is not a privilege. And so what we did to make sure that people could find something in the box that they could eat, we got together with Douglas County Health, told us what they needed. We brought together our community partners, all these different communities, these different immigrant communities, gave us a list of items that their people were comfortable eating. We took all of that data. We found similar items between all the different communities, and from those, we created another list And from that list, we use that list to build boxes so that no matter who comes in to get a box, when they take that box to eat, when they open it, it will be food that their community has said that they can eat. And that's across all the communities that we serve. We all submitted the data, we analyzed all that data, and created the boxes that they now get. So when they come on site, they grab it, they open it. One of the problems that they were having with some different boxes that they were receiving is they were opening it and not seeing food that they were familiar with, things that they didn't know how to prepare. Anybody, when they open these boxes, anything that's in there. So you see lentils, oil, sugar, flour, proteins, canned fish, chicken, corned beef, beans, rice, raisins, all these different things that they said they need. It's in the box, and they get that. And then we can also supplement, since that's all shelf stable. What we do on the back end is, since we have fresh produce, we have perishable items, all that data that we gather from the people that are receiving these boxes, we also still do home deliveries for them. We take all that data, and if they need something in addition to that, we can do follow-up deliveries via Whispering Roots to make sure that they're getting supported with fresh produce and things like that. Current box distribution sites, here we do the Heartland Integration Center and Center Mall. You can see the different folks where we deliver these boxes, how they get built there, and we still do our emergency home deliveries if there's things that are in need. All that the health department has to do is reach out to us and let us know who it is, just give us contact information, and we take it from there. We make all the contacts, we do all the scheduling, figure out the food, we do all the deliveries. That's all handled by Whispering Roots. This is not a misspelling up there, it says teamwork. This was a team building event with members from the Douglas County staff who came over to help build some of the boxes that go out to the community. I say it's not a misspelling teamwork because when they come in and say, "Oh, we're doing the teamwork event," and we say, "Yes, you are doing, your team is going to work." That's what we tell them. You're going to work building boxes. It's a great event. If anybody wants to come out and participate and help build boxes, we always look for volunteers. But it's great to get on site and kind of see how this works. I mean, when I leave here, I'm going to change clothes and my shorts and t-shirts, because today is also Community Organization Distribution Day for us in our food hub, where 30 plus community organizations come in. They have choice. They'll go out, they'll fill their cars or build pallets with all the different food items that we'll put out for them, the food that meets the needs of their client. We'll load that into their vehicles. They'll leave and they'll go do just-in-time distribution since they don't have cold storage. Every Wednesday, it's community organization delivering for us. Some of the highlights of what we've done: approximately 9,730 emergency food boxes created during this program to date. What does that equate to? We say about 39,000 people in that. And we always underestimate. About 3 million plus pounds of emergency food distributed by the organization last year, 65,000 plus people served last year. Commercial kitchen operations, supply and logistics operations, still handling all the emergency food home deliveries. We also partner with multiple organizations in Omaha that are doing that. We feed them as well. We do all their purchasing for them, all their storage, and the just-in-time delivery for some of these organizations. We've won lots and lots of awards. We don't do this work to receive awards, but the rewards that we receive let us know that we're doing the right work. We specifically like the community awards, where the community tells us whether or not we're actually meeting their needs. We can pat ourselves on the back all day long, but if the community says we're not doing the right thing, then we change our work. And then we logistically support multiple organizations in Omaha. We work with the Food Bank, Heart Ministries, Catholic Charities, Simple Foundation, and others, helping them streamline logistics work. Future engagement opportunities: continuing emergency food box delivery, culinary classes. We do culinary nutrition classes, cooking classes on site, adult and children together. Partnership opportunities are out there. We're going to sit and have some meetings about that. And then, of course, strategy development, because that's my background, is food logistics, health, computer science, and things like that. And that's it. I think I'm at my time. If you have questions afterwards, please let me know. You can always reach out to us. We are interested in having volunteers, and you're always welcome to come out and participate and see what we're doing on the ground and what the community is encountering with that. Questions?
Thank you for this great service that you're providing to the community, first of all, and thank you for your time being here with us today. My question is, how does the family apply for your service? Is there an application process?
We have several ways that people can apply for the service. Through some of our partners, we get referrals for people that come to us. Depending upon the network that they're in, we have veterans that will come through some of our networks. They'll phone in. We have a phone number that people call if they need emergency food deliveries. We get referrals from our partners. They'll give us their contact information. And then some of the folks, it's through pantries that know that we do our work. A lot of our work is word of mouth. And then online, they can always go online and then they can contact us that way as well. And if people want to set up a partnership with us, we do that as well. We are really, really busy right now. We are extremely busy. But it's what we do. My goal is to work my way out of the job at some point.
where is the exact location that one would come to volunteer?
So, you can contact us because we have our warehouse, which is our food hub where we do food distribution there. But then we also have our culinary facility where partners come in and they help us package meals, they help us prepare meals and package. We also have people who go out into our gardens. There are several opportunities. So you can certainly reach out, contact us online, and then we can figure out which volunteer opportunity would best fit. We also have groups that come to us, and we do Farm Credit Service of America sends folks to us all the time. We also do a huge Thanksgiving meal preparation opportunities, and a lot of people doing that as well. And that takes a lot of eyes.
Do you use volunteers to, can you utilize volunteers to prepare the food?
Yes, we do. And we get groups who will reach out to us, who will come out, and they'll go into our culinary facility, and then they work with our culinary team, and they help prepare the food, package the food, wrap the food, box the food, and get it ready to go out. And then usually when we do that event as well, they come in and we feed them a meal. They eat the same food that we're going to be distributing. They get a chance to sample what's going out the door. And we can always use hands there as well. Any job that we do, like gardening, we can use you in our gardens, growing food. We have a ton of community gardens as well scattered around Omaha with different organizations that we support.
Greg, just thank you for doing this update. I remember we've had conversations, but it was back when, like 2015, 15, we were just kind of getting up and running. So it's a joy to see how much you guys have grown and have really pivoted based on community. So thank you.
Thank you. I mean, we're really, for me, when I started the work, it was just about giving back. I had no intention of becoming what we are today, but it's what's necessary. We all tell my wife when I started, we used our own money when we started. You know, we took no grants. It was our own savings. And leap of faith. My wife is going to be fine. I'm leaving my job and we're going to use all our savings. It's fine. But
Well,
it was
that's your
just,
wife.
right? It was just, I meant to give back. So it's nice to hear that feedback and to know that it's nice to know that we're actually meeting them. That's what we do.
So Greg, is that for emergency food network that started during COVID? It was like the emergency, all the emergencies. What's an emergency now? Or is it just a food need distribution now? What do you classify as emergency?
So for us, emergency, people who are in dire need, who don't have access to food, who need some type of food. We have people who are also, who don't have transportation, who can't get out and get food, who are homebound. People who come out of the hospital, who can't get out and shop, we feed them as well. We get referrals from pretty much everybody now. And then, of course, we raise funds to do that. We get donations that come in, and then we build boxes and things like that based upon the needs of the client. Some people have really specific dietary needs, and we also make food that's specifically for that. Deal with some of our homeless population as well. And I don't know if I have that picture in there, but you'll see with our homeless population, we'll do different types of meals where it's, since we have a lot of dental issues in there, you'll see a lot of soups, rice, things like that that are easy for them to eat if they're having their dental issues. So we have to make sure we tailor it to our client.
So give me a feel, because I'm trying to just gauge this in my mind, because I know it's a need, but I'm trying to figure. Well, explain to me how this is going to settle out, because so the county had the money during COVID, you had CARES Act money, you had ARPA money going through here. And we were talking about food needs, but every time people come to the county, they'd be like, okay, the food, as far as the county have to give people money to get food, it's kind of settled. You always trying to get it out. I'm trying to see now, after all this money settles out and it's out everybody's budget. I mean, what's the food ecosystem out there? Tell me, how are you? I'm trying to get a feel for how you, the 1 through 5 food bank, all you all are working in this ecosystem.
Yeah, you know, the problem with food these days is when you look at the economic state of America, right? I do a whole different presentation about this. This is an issue that is very difficult for the United States to solve, right? We see all these signs and, you know, all these stories that say the economic status is great, but at a basic level, people can't find healthy food to eat in underserved communities. It's a problem between production and logistics. It's a problem between distribution, which is hard to solve for some logistics guys. So that's what we're working on. But it's also around economic development. The way that we solve this problem, education, economic development, getting people off the roads. We're always going to have a need to feed somebody somewhere. But This is really a comprehensive multidimensional problem regarding education, economic development, food logistics and production, and then also storage and distribution. But the problem is, a lot of folks, it's siloed. We saw a piece over here, but it's not, we're doing economic development, but it's not connected to the food. We're doing food, but it's not connected to logistics. This food being produced in, say, North Carolina, that could be used in Omaha, but there's no logistics chain to connect that. Right? So we need to be having higher level strategic conversations. You saw one of my notes on the strategy. Strategic conversations about how do we connect the dots. One of the reasons why I'm on the ground, why I drove the trucks, worked in the kitchen, did all those things is so I could understand what the problems look like, and then start sitting down and having real hard conversations with people about changes that we need to make, all the way through our political side. I've talked to our political partners as well about how do we fix this. It's not going to be easy. It took us a long time to figure this problem.
Bacon, Satizo, agriculture, or something.
Talk to them all. I'm going to talk to them all.
And the two of them are agriculture, fish and bacon.
Right. And so these conversations need to be taking place, connecting community. I'll sit down with the immigrant farmers who want to be able to grow food, but need to have access to land. But then they grow it, they need to have somebody to sell it to. Then it needs to be distributed. We're vertically integrated. So we take those immigrant farmers, we will pay them for the food that they're growing. We will collect it and take it into our facility. We will then push it out through our distribution network into these different organizations that need it. Over the last 14 years, we've been slowly building a network that allows us to do all of these things so we can now connect the dots. So why do you drive the truck? Why are you out in the garden? So I could understand what does it take to actually get that work done. And then when I'm sitting down at the table to talk about strategic development, and having also been in the military and also in the corporate world, we can speak about it differently. So this is a conversation that we should probably sit down and talk about now, because it's also going to take our political leaders working together to bridge all these gaps. You talked drones earlier. Drones is part of the work. We have a whole drone program that's designed to get these kids into the STEM network, into the drone side, because there will be good paying jobs there. But then we also do things like plumbing, electrical, carpentry. It's all part of what the kids are building in the classroom, ag, growing crops, doing raised beds. It's not just because it's fun, it's hands-on experiential learning, getting these kiddos ready for the next work that's coming. Yesterday, we were talking about literacy, because some of the programs that we're doing on the STEM side, like data science, if our kids can't read, by the time they get to high school, by the time we see them as seniors coming out, they're not ready to go into the data science program at UNO. How do I know these things? When I worked at TD Ameritrade and Ameritrade back in the day, we literally built pipelines to help people understand our technology so that we had kiddos who would come out of UNO, UNL, Milford, who could actually run the technology over at Ameritrade back in the day. So I was going back and forth between Omaha and the East Coast because we had a lot of technology and knowledge on the East Coast, but we wanted to keep that in Omaha. So we literally had to develop our own pipeline for that. So I've done this many, many years. It's always the same, but we just need the right people at the table to get this.
So what is UNL School of Agriculture?
Okay.
What is the School of Agriculture at UNL?
So they're doing a lot of different projects. I also, every year, I go out every semester and I speak at UNL with folks in the engineering side, and we talk to the engineering students and things like that. There are a ton of programs that are underway right now. You know, the UNL Ag is doing things. You've got different school districts that are doing things. We just need to connect it. I mean, we actually did a presentation at UNO a few years back. It was with UNO professors. Congressman Bacon was there. People from UNC were there talking about these pipelines and how they need to be built. And now we're partnering with Nebraska Med, UNC, CHI, Methodist on all these different initiatives. But we need to start tying it together. I just need some more. I need more bandwidth. That's what I need. This is 14 years in the making. This is 14 years of on the ground hard work, understanding where the challenges are to come up with real solutions. We should talk.
Yeah. But all right.
If we can get a copy of the presentation, send them.
Thank you.
Thank you.
All righty. Item B, emergency response.
Hey, everybody. Well, we're excited to be here and present for you on emergency preparedness and response here, at Douglas County Health Department. My name is Kurt Morrow. Dr. Hughes, thanks for that nice send off and kind words. Appreciate that. So Caleb and I, he'll introduce himself in a second. We've been working together for a little under 2 years, a couple months shy of 2 years now on emergency preparedness and response. Kind of a wide scope of work that we do here. We'll try to break that down in this presentation, talk about the different federal grants we work under, and talk about the different phases of preparedness and also a couple of responses that we've worked on over the past 2 years. Caleb?
Yeah, I'm Caleb Pettis. As Kurt said, we've been here almost the exact same amount of time, so we've worked together the whole time we've been at Douglas County. Thank you for the opportunity to speak before the board today, and it's also humbling to come after Whispering Roots. It sounds like an amazing program that you guys have. So with that, Kurt.
So phase of emergency preparedness. You'll see a circle here. It comes up all the time in different trainings, and we will explain it to you. So preparedness is where it all starts. It's the pre-planning for responses, educating, training, getting ready, working with different community partners, community outreach. Response is exactly what it says, responding to different emergencies. Recovery after the emergency, there's a lot of different parts of recovery to try to build back and keep working on things that might need work on that were either exposed during the response or need additional help. And then mitigation is right before preparedness. It's just continuing to build on some of those recovery aspects. So FEP, you'll see on the screen, FEP and CRI. So FEP stands for the Public Health Emergency Preparedness Grant. It's a nationwide grant. It provides health departments throughout the country funding for emergency preparedness. There's a lot of different parts to the FEP grant that we'll explain throughout this presentation. The CRI grant, that stands for the City's Readiness Initiative. That's part of the FEP grant, but that started after 9/11. The federal government started pushing out funds specifically for large metropolitan areas so that they could prepare for an emergency such as an anthrax attack, where all the citizens potentially would need antibiotics or medical countermeasures. So we work closely, and I'll explain it more, but we work closely with the other 2 local health departments in this area. We're part of the metropolitans, they call it the MSA statistical area. So it encompasses Sarpy County and also Three Rivers Health Department. So those 2 counties all involved. So we work together on a plan for distributing medical countermeasures if needed, and kind of the planning aspects.
All right, and I'll talk a little bit about FEP. I principally work under the FEP grant. Kurt principally works under CRI. FEP's a 5-year cooperative grant that's been available since 2002 from the CDC. As Kurt said, they started pushing this money out to prepare for emergencies as a response to the anthrax attacks that happened after 9/11. States and territories and tribes are the primary recipients, and local health departments like Douglas County are usual sub-recipients from the state. We get money from the state to maintain a FEP program. And it's just a large scale, a broad scale grant that allows health departments to build and strengthen their response to infectious diseases, natural disasters, and CBRN, chemical, biological, radiological, and nuclear emergencies. We have both an inward facing side and an outward facing. And what I mean by that is inwardly, public health departments often have to restructure themselves to respond to an emergency, and we're responsible for coordinating that aspect. But outwardly, if a natural disaster or an emergency happens that involves the larger response community like Douglas County Emergency Management, police, fire, whoever else might be involved, we also form a representation to that, representing public health as well. So the capabilities of FEP, this is kind of what the work plan is for departments that receive FEP funding. You can see these 15 preparedness and response capabilities up on the wall here. We're not necessarily responsible as a health department or as a FEP recipient or subrecipient for actively doing all of these things. But if there is another agency that does these capabilities in our community, we're just supposed to maintain memoranda of understanding with them and make sure that they're covered. A good example of that would be mass care, number 7. Mass care refers to sheltering after an emergency or a disaster. And we have a supportive role for that as we performed during the recent tornado event in Elkhorn. But in the local Douglas County local emergency operations plan, Red Cross is the primary agency responsible for mass care. It's not Douglas County Health Department. That's different in other parts of the country where the health department may be running shelters themselves. Public health laboratory testing, we don't generally do laboratory testing. That is provided by NPHL, Nebraska Public Health Lab. A lot of these other capabilities, though, they form the content of what we're doing throughout the preparedness cycle in the year, and we'll talk about that in a minute. With the new renewed FEP grant starting later this year, they did come out with a readiness framework, which is supposed to guide how we implement these capabilities. And a lot of this is in response to issues that came up during COVID. I won't run through all of them. You can kind of see there's a lot of words up on this slide, but one of the big emphases is prioritizing a risk-based approach. Last year, we participated with the state of Nebraska and all the other health departments in what's called a jurisdictional risk assessment process. It was actually led by UNMC. We worked together to determine what hazards pose the biggest threat to public health in Douglas County, and all the other health departments did the same, and this was collated into a statewide report that was provided to CDC, who provides these funds. In Douglas County, we determined that it would have been winter storm, severe thunderstorm or tornado, a fire, a pandemic, or a hazardous materials event. Pretty much all of those we've had within the last 5 to 10 years or so. A lot of this has to do with maintaining relationships that were built during COVID with community partners. When you're responding to an emergency, there's almost no agency that can do it alone. Risk communication, health equity, data modernization. I know we've heard that earlier here, that's a big emphasis kind of everywhere with the CDC. Prioritizing community recovery efforts, and administrative and budget preparedness is a big one that we're going to focus on, I think, in the next couple of years. And what that is involving our procurement and our county purchasing in our preparedness activities, because like everywhere across the United States, there were issues in getting staff, retaining staff, and getting staff in response to COVID. So we want to make sure that those processes are streamlined and that we can respond well next time. So Kurt can talk a little bit about CRI.
Yeah, so as I mentioned, Cities Readiness Initiative, we work with different government agencies, different community partners to develop agreements and help them with their plans. I kind of covered this part already, but how it works is how it should work is if say there was a large emergency such as an anthrax attack, well, we would receive medical countermeasures, antibiotics from the federal government. It would get sent to the state, and then the state would distribute it to us, and we would distribute it to the other 2 health departments I mentioned. And then we would work with different already recognized partners, pre-planned partners for them to either deliver the medical countermeasures, the antibiotics to their students, their staff, their clients, or we would set up what are called pods, points of dispensing, similar to the vaccine clinics during COVID, to push out these antibiotics to get the whole population the correct amount of antibiotics that they would need. Next slide. So this is if you ever heard of the Strategic National Stockpile, referred to a lot as SNS, this is where the federal government stores all of these medical countermeasures, things such as PPE, different medications, various things. So this is where everything will come from. Now, if there's a smaller scale emergency, what we would do is if we just needed one particular item that we weren't able to get locally, we would part of our planning is how to send a request to the federal government to request this asset from the Strategic National Stockpile. So a lot of our planning has been working through that process. We work with emergency management in that process for the request. It also would go to the state, and then the state would push that up to the federal government. Okay, next slide. As I mentioned, this is kind of the flow chart for if there was a request from the Strategic National Stockpile. Goes to the feds, goes to the state, and then we're the local distribution site. We would, like I said, give it to the other health departments. They would do the same thing we would be doing here in Douglas County, which is set up these points of dispensing, both as a health department and also these other closed pods, which is these organizations that we have agreements with who would distribute to, again, their staff, large employers, religious organizations, schools, so that they don't have to all go to these other sites that we had opened up. Next slide.
All right, so what I'm going to do now is kind of take you through the 4 different stages of the emergency preparedness cycle and just talk about some of the projects that we're working on in each of them, because really all of these things are happening at the same time. You're just in different states with different situations. When it comes to mitigation, so with mitigation, you're putting infrastructure and systems in place that are basically going to lessen the impact of an emergency or a disaster when it happens. We use a program called AlertSense that is actually contracted with Douglas County Emergency Management, and they graciously allow us to use it. But one thing that we have really emphasized is keeping up to date staff communication information, whether it be home phone numbers, cell phone numbers, email addresses, whatever, or new staff that comes in and staff that leave. Make sure that we have the right people in this AlertSense program. And what that allows us to do is send out a message to everybody at once through all these communication platforms. So we test that quarterly, and we've also used it a fair amount with the severe weather this spring. You see that on my 3rd point there. We've had an unusually severe weather season this spring with a lot of tornado warnings and things like that. And we've really tried to emphasize staff safety, which falls under the theft capability responder safety and health. Making sure that staff are aware of what's going on, whether they need to come back to the office, things like that. And we use AlertSense and other methods to make sure that we get that communication out. Epidemiology and disease surveillance. We put a lot of our FEP funding toward our epidemiology department, and that's just part of the structures that we put in place to, if there is a disease outbreak happening, we are able to catch it early, mitigate that, and make sure that the impact is not as severe as it would have been. Preparedness would be the next. So this is more the planning side of things and making sure that you are ready for whatever could happen. One big project we worked on in the last year is starting to plan for a community reception center. And I think maybe Justin might have talked about that with you guys before, but if he hadn't, brief overview, if there were a radiological emergency, we would want a place for people who are the worried well to go to, people who didn't necessarily receive a high radiation dose, people who are probably fine, but they can go and get tested and also receive some information about how to safely deal with the situation. And that's something I'll show you a little bit more about in a minute. We work to update our plans and MOUs based on actual exercise and response data. Part of that response bit, if you're not actually responding to an emergency, there are requirements of certain exercises, whether they be tabletop exercises where you talk about a situation or full-scale exercises where you actually act it out. And if you aren't actually responding to something, you would use these exercises and the lessons learned from those to update your plans. And we conduct risk analyses. Every couple of years, we do a hazard vulnerability analysis, which refers to the hazards that our building and our staff face. Last one was done in 2022, so we'll be doing another one later this year. And then, as I spoke earlier, the JRA that we participated in with the state. A deeper dive into the Community Reception Center. So early 2023, this came up in the radiation surge exercise for the Healthcare Coalition. We did purchase some equipment to use for this, and we also put together a plan for the use of Baxter Arena as a site. I realize this is a small picture. You can't really tell what's going on, but it kind of gives you the sense of how this is a complex situation where you have screening at the front door. If people have some level of contamination on them, which we purchased equipment to detect, then there's a process for them to go and get cleaned off. We would have phlebotomists on staff or on site to draw blood if necessary, and places for people to get reunified with family members if necessary. So that's an ongoing process that our deputy director Justin is actually working on for his doctoral dissertation. So he's kind of taking the lead on that.
Yeah, and I'll just add, important for you all to know that this type of plan doesn't really exist in Nebraska at all with other health departments. We're the first one here doing it. Kudos to Dr. Hughes and Justin for volunteering for us to take on this planning process. It does exist throughout the country. When we started the planning process, we reached out to health departments nationwide to see kind of what their plans looked like so we could have a good idea of how to work on ours. And yeah, it exists a lot of other places, but it's new to the state and new to Douglas County. So thanks to Dr. Hughes to volunteering us to take on this challenge.
Yes, and as we roll forward with this, we'll identify other sites and come up with plans for them as well. Baxter Arena was just kind of the first one that we talked to UNO and UNMC, and they were interested in working with us on this. So more to come on this in the future. When we get to the response, so I talked about when you aren't actually responding to emergencies, you have exercise as well. We actually had some emergencies. Last October, all the way through January, we dealt with the rabies in a kitten, raccoon rabies, which isn't found in Nebraska. And that took quite a bit of coordination with federal agencies. It was the Department of Agriculture. Kurt can speak to that better because he coordinated most of that response.
Yeah, so this one was a joint effort between us, the CDC, USDA, Humane Society, some other environmental and similar organizations in the area. We worked on it pretty heavily in the month of October, November. Timing was kind of unique because the phase of this where they actually went out and we distributed the vaccine packets was right around Halloween. So we were really trying to work closely with Phil, our PIO here, and everyone else involved in this to try to get the information out to the public so that there were no concerns with kids trick-or-treating and the timing of getting this rabies vaccine out in the areas that they had to hit.
And when it comes to these responses, so I think you guys have heard maybe from Dr. Hughes and from Justin more from the big picture command aside what our role in something like this would be. We're setting up the meetings, bringing people together, arranging for volunteers, arranging for supplies to get where they need to be. So we handle a lot of the planning and logistics, and internally setting up our incident command structure and communication internally, things like that. Right after rabies, obviously we rolled into the large tuberculosis exposure at the daycare at the YMCA. So with that, within 72 hours, we had to set up meetings with the CDC, with Children's, with UNMC and some other partners. The Y. We also had to set up large-scale testing operations, which Kurt was on vacation that month, which was nice. So good for him. Had to roll a bunch of equipment out to the YMCA, set that up, tear that down every day, and arrange the logistics for that. I like to say that our job is the boring side of very exciting events a lot of times. So with the Arbor Day tornado, we had a couple of different roles in that as a health department. We responded to the initial emergency operations center the night that it happened and handled some of the medical coordination there, did safety assessments of the mass care site. And then later on, there was the multi-agency resource center set up by emergency management, and we coordinated Douglas County Health Department's participation in that. So we were able to send some community health workers, and our environmental division had some information and supplies for people that we were able to have up in Elkhorn and have available for the people that were affected by that disaster. Then finally, recovery. So the quick definition of recovery is basically putting things back where they were after you've moved them when you're in a response. Part of that for us is after action reviews and reports. We've obviously done that for the rabies and tornado. We write reports, we go around, we do surveys, we talk to staff, we find out what things went well, what things could be improved. And we really try and encourage people to be candid about what could be improved. They're never going to hurt our feelings about that, because we all want to do better, and we all recognize that, you know, there are always things that can be improved with any emergency, and it usually starts with communication. That's the one thing that always comes up. So, and we use these to generate reports and improvement plans that we then check in on periodically and make sure that we're hitting the benchmarks that we set for our improvement plans and making the improvements that are needed. And then, as I spoke, we help with the multi-agency resource center for the tornado, which is a recovery operation, really. And so that's not all the things that we're working on. That's just kind of a sampling that we felt we could fit in on this time. We're always working through this preparedness cycle and all different kinds of events. So if anybody has any questions, though, we'd be happy to take them.
Also, just,
Okay.
Justin is at CSTE this week, which is the big national conference for epidemiologists. And I believe it was USDA presented on the rabies response that we had here, and got huge kudos for the Douglas County Health Department and the collaboration and communication in response that we were able to help coordinate here. So good job to my entire department, but especially to my ERCs.
Yeah. Can you guys hear me?
Oh, yeah.
And
Hey, this is Justin. I just wanted to kind of add on to that a little bit. The USDA actually presented this at the plenary session with 3,000 epidemiologists in attendance. And so the entire talk was around One Health, which is a holistic approach to health, including human, animal, environmental. And that talk was all about the rabies response that happened in Omaha. And like Dr. Hughes said, we received extremely high praise about there was no competition, there was no bias, there was, you know, it was just all these subject matter experts coming together to really formulate an amazing response. So Nebraska had a really strong showing at CSTE this year, and this was the first time that we've been kind of on the national stage like that at this event. So again, epidemiologists from all over the country are seeing the amazing work that's being done in Nebraska and in Omaha.
Thanks.
So I was curious, you get any sleep at night having to worry about all the horrible disasters, or you sleep pretty well because you know you're fully prepared for anything that happens?
Well, it's kind of unique. Caleb and I are a unique team. We both come from law enforcement and also public health before we came here. So we've had sleepless nights before, but we both sleep pretty good, I think. So
what's a few more? We have kids, we don't sleep anyway. Yeah.
What's the dollar amount thing receives for the FEP?
So for FEP, we receive $459,589. That's over 5 years, correct? Yes.
Is that?
No, I'm sorry. That's per year.
Oh,
that's per year. Yes.
Second question. Explain the incident command chain using the potential anthrax. If there were an anthrax outbreak here, who finds out about it first? And then, given what we know just recently happened, who declares the public health emergency?
Well, that's a good question. I won't have an answer for you. It just depends with anthrax on what law enforcement agency is involved. FBI will probably be involved. Federal government will be involved. On a thing like that, it's so big that it'll definitely be a unified command approach. We would be having a large operation for the as I mentioned, the points of dispensing and the giving out but there's a lot of other parts to it. So it'll be it would be a community-wide operation. It just depends on, as far as finding out, it could be, I'm not sure, it would all depend on who first discovers it, where it's at. And then it would just be from there.
Hey Kurt, this is Justin again. As far as like notification goes, there are often white powder incidents that occur, law enforcement's involved, and then those specimens are actually taken to the Nebraska Public Health Lab where we can test for anthrax. So we would be immediately notified if they had a white powder incident that they were testing. First of all, they'd probably call me and let me know that they are working on that. And then if it were positive, obviously, we would have to assess the situation to determine how many people were potentially exposed. If you're talking like a community-wide release, that's, I think, where you would see more of the SNS involved. If you're talking, let's say, an elected official, that may be a much smaller response involving just a few people. So it just varies, but the Nebraska Public Health Lab does do anthrax testing, and we'd be connected with that.
And just to clarify, we would set up, so there's a couple of different chains that you would see. Internally, we would have our ICS structure set up internally where, I'm the incident commander, Justin is my deputy incident commander. And then we have staff who are kind of pre-assigned into those roles. But absolutely, in terms of the community, it would be a unified command approach. So you would have basically the incident commanders from each of those organizations that are coming together to coordinate on that response.
In hindsight, that was not a great example for me to have thrown in. I'm trying to drill down to the everyday public health emergency. We can make it, the tornado or something really local. But what I need to clarify is, because Dr. Hughes is the director of the health department, but am I correct that the mayor has determined that she would be responsible for declaring a public health? What was the whole thing with?
That was around DHMs, so direct health measures. So I can declare a public health emergency with the board. But if we needed to issue a community-wide DHM, I'll say the forbidden words, mask mandate, something on that level where you're requiring some kind of action of the entire community.
Right.
I could make that recommendation to the mayor, and she would have, I think it's 24 hours to respond to that, to either say, yes, let's do that, or no, let's not. And then it goes to city council for essentially veto or approval. So there are a couple of different steps that it would have to go through to become official if we were to do something like that. But declaring a public health emergency is a little bit of a different action, and that's something that we are able to do that. Declaring a public health emergency isn't necessarily requiring anybody to do anything necessarily. But it does potentially, especially if you have a large enough response where you're bringing in, FEMA or NEMA or kind of these larger organizations that might be able to provide resources. If you've declared a public health emergency, it can just help facilitate being able to receive and utilize some of those resources. And of course, it's a message to the community, hey, this is something really serious that's going on, and here's what we're going to be doing. Thanks.
So, you all, there should be the lady that Phyllis, who we had the contract with, media emergency stuff.
For the Healthcare Coalition?
Yeah,
Yeah.
You all tied to that.
Yes.
They used to meet every Wednesday with members. I don't know who's that. I think a new person runs it.
Yeah, it's Justin Watson from Nebraska Medicine who runs it now. We're tied in with them. They meet. They don't meet once a week now. They meet monthly for what do they call it? A general committee meeting, I think. And then they also have all kinds of subcommittees and work groups, and we participate in some of those, like non-hospital healthcare, which is mostly long-term care facilities and what's going on in them. We'll participate in that. Their training, equipment, and resources work group. They actually had some equipment stored in our warehouse, so we participated in that. And they also have a planning, exercise, and training work group that meets monthly as well. They're big on doing full-scale tabletop exercises in our community, even more so than we are. That's a big part of the grants that they receive. So we serve on that work group as well.
So, sort of like the grant, so the started after 9/11.
Mhm.
They probably have some funding. Give me the lineage, because I'm trying to figure out which are after action reports say is now over, because we've had the issue with the maps.
Mhm.
And then you had 9/11, so you had the start where anthrax was. But then we had, and that's what I'm saying, give me I'm just trying to.
Kind of a timeline of FEP.
Timeline of the funding has evolved, because then
Sure.
You had Ebola,
Mhm.
and then the federal government did an update of this pandemic. We got lost, or whatever happened. And how does the after, what's flowing now? Because you had
Sure.
big when everybody expected something.
So there's, I would say that there's two sides to that. There's the public health side and the emergency management side. When FEP first started, it was really focused on combating bioterrorism and setting up pods if there was some kind of massive anthrax attack. And that was really the sole focus of FEP. I think a lot of the early FEP coordinators were called bioterrorism coordinators. Over time, especially after Hurricane Katrina, FEMA really changed how they plan for emergencies to what they call an all hazards approach, where you basically put structures and players in place that could respond to all different kinds of emergencies, regardless of what they may be, and try and simplify things that way. And FEP followed that direction. Around 2012 is when they first came out with these 15 FEP capabilities. And those really take an all hazards approach following FEMA. As things kind of evolved, as you said, through Ebola and even up to COVID, those 10, I can't remember what they call them, but what these refining emphases of the FEP capabilities, that's their response to that, getting into better risk communication, better administrative preparedness and procurement practices and things like that, and a hazards-based approach. They don't want people just out there doing exercises to do them, because that happens, I think, in all kinds of government agencies, unfortunately. Because if you have grant money tied to something, sometimes you have to check the box. But they want people actually doing things that they determine are going to impact their community and preparing for those, and putting really a harder focus on that. Before that, there were prescribed exercises that everybody had to do. Like everybody had to do an anthrax exercise every year, or a flu exercise every year. But they want that to be more tailored to the local community now. So that's the way that it's evolving. Yes.
So I have a question in regards to that. If you are choosing specific hazards for a community, why is radiation one of your projects? And can you educate the public on the exposure of radiation? What are the causes that the public can be exposed? And then when do you call a public health emergency for radiation exposure for a community?
Yeah, so reasons that we determined radiation was a risk that we might face is because of the big community events that take place here, especially like the College World Series. That's always been kind of something that's been focused on for potential terrorism. We also have STRATCOM at Offutt Air Force Base really close to us, and they are actually the nuclear command for the United States. So if we did have some kind of a nuclear attack or something like that, we're pretty sure that at least Sarpy County would be targeted. So we would have to deal with that. And there's also just, I think it's something that's underprepared for everywhere, because we have radiation sources in our hospitals. One thing that we've talked about a lot in this community reception center is there was an incident in Guyana, Brazil. Forgive me if I'm taking too long in this anecdote, but a radiation source from a hospital actually got into the hands of some junk dealers and passed around the town. And I think around 120 people got exposed to radiation and 15 or so died. But once this got into the news, 100,000 people sought care and treatment. So that is what we're trying to provide with the community reception center, is a place for those people to go so they're not overburdening the healthcare system. As far as how we would determine a radiation emergency, that probably wouldn't be us declaring it at the beginning. It would probably, in most cases, be fire and rescue that responds to that and gets us involved. It would be, if there were any kind of a radiation release, I mean, that would be just an emergency. They would be declaring a disaster, making a disaster declaration. So I don't know if a public health emergency would add anything to that really, but yeah.
You know, it would really be based on the circumstances of
Mhm.
the incident, and if we did do that, again, you know, if there appeared to be a large impact, many people exposed, you know, potential loss of life, if we had ongoing exposure, so something like that where it's not well contained, those are all things where, you know, I could consider declaring a public health emergency, but again, it's gonna be completely dependent on really what's happening within that incident. You know, if you have, you know, a small amount of radiological material that's taken from somewhere and it's well sealed, it's well transported. I'm thinking, hey, we've got I-80, we got all kinds of weird stuff that comes across I-80. You know, it's well sealed, it's well protected, you have minimal exposure to the public. That's probably not something that I'm going to declare a public health emergency for. So you're really looking at the kind of incident where you're going to have a true impact in your community or it's a part of your community. So it could just be part, you know, that was seeing that issue and you can declare it there.
I'm kind of getting back. Oh, sorry, go ahead.
Sorry, just another question.
Mhm.
Being part of a healthcare team, we are supervised for exposure to radiology within like our dosimeters that we carry every day.
Mhm.
How would a public know if they've been exposed? Is there signs and symptoms, or is it different from other hazards that they need to report essentially to the health department?
Yeah, so if something radiological were to happen, there would be signs and symptoms that we could put out for people to look for. And that truly depends on the dose and what kind of radiation it is. I mean, it could be if they had internal contamination, it could be, you know, nausea and vomiting, it could be burns on the outside of the skin. There's all kinds of different things that could happen. You know, really, whether or not you know if you were exposed, it's gonna be more where you were when it happened and your proximity to it, which way the wind is blowing. And getting back to our CRC planning, our plan for that is some of the equipment we got is actually dosimeters and pancake probes and actually walk through, what are they called? Portal monitors, yes, that people would be able to walk through and assess if they have any external contamination. So one of our emphases in planning this will be making sure that we have staff available, whether at the health department or agreements with others that can run this equipment and use it.
One of the things that spurred us to look at doing a CRC here is that during a radiological exercise, the question was asked, well, who sets up the CRC? And there was kind of just blank looks across the board. Come to find out, there was no one in our region who had the capacity or the plan to set up a CRC. And so I said, we would do it.
And talking about our region, so we're in FEMA Region 7, which is Nebraska, Iowa, Kansas, and Missouri. And following our lead of setting that up, I guess Kansas City is actually working on setting up a plan for that now. So there will be another one.
So, probably board can tell me if they're talking this, but this is an ICU. So basically, July starts in the fiscal year. I would say two things always stick out in my mind about emergencies. One, Mike Fahey was there, and I was working for him at his re-election, but when he ran the first one, you got to ask the emergency management question in the debate, and deer and headlights, because nobody expects this question. And I saw Tom Vilsack when he was governor, and he urged everybody in the room understand what the hell is going on. emergencies, because that's when it's your time. So I don't, you can't do a tabletop, but I would like you all to work on something way far in advance where the board can plan out Friday, rooms and things. Because I would like to walk through. I want you to turn tabletop, some type of exercise, so everybody just understands the basic framework. You can lay this out in detail and you know, the situation, because this is like, you know, one of these things that I think about, if somebody asks me a question, what's the framework to know? Absolutely. The second thing is, I don't know if you all, you about to leave, so I'll just close, but, there is, it's the question we actually got from HHS, okay? Because my piece is that you got strapped. You got all these things, here, but the main thing that's here is the next project whenever it comes. My biggest thing is they're getting all this money to have that up in the head. But the health department responsible for it is not getting it. I thought that 40,000 would be more. I'm sure there's more you can do, and I keep thinking we need something in pocket. I mean, give me and Justin, you know what I'm talking about.
That's what I was gonna say. I was gonna say Justin
Yeah.
thinks about this all the
I
time.
need you all get in the room, do something with them, because it's kind of one of these things, be prepared for the opportunity to come. Because it's two phases, you pitch this at, either the state to ask for a certain amount of money to be designated to this health department because of proximity there, the proximity of what this is, or to ask the Fed, because they're getting that money. And the Fed, my idea is always, okay, they probably need to get another million to 1.5 kick in, but the health department will be ready when this happens. If this happens, and they're always up to speed with federal money, we got to use county stuff to get up to speed. You're not gonna be able to run, kind of like when people got put in from Ashley during COVID, and they were like the biocontainment was always there, but when it has to go, they wouldn't. So I mean, you want to put it in paper for any ads, just to keep it, because it'll tell you the opportunity.
We're also having conversations with some community partners about that. Justin and I have been strategizing a little bit around that. And we did allocate a small amount in FY 25 that basically is our don't touch it money. So that I think it's probably come up every time we've had some kind of emergency. We don't have, we're most, 60% grant funded. We can't just use our grant funding to finance a response because it's very, those grants are very earmarked for specific things. We really need to be prepared fiscally for things that come forward. And so we have at least a little bit set aside kind of informally so that when we have the tornado, when we have the rabies, when we have the TB, whatever it is, we're not wasting our time going, well, how are we going to pay for overtime for our staff? How are we going to help, X agency with this issue that we need them to take care of, but they can't afford to do? There are all of these little nuances fiscally that come up that we have not been well prepared to deal with. But to your point, when it's something huge, when it's something community-wide, or something very severe, it'll take more than a little pot, to take care of that. And we do need to be well aligned with kind of the response capability at UNMC with the Biocontainment Center, and we're not there right now. But Justin and I, like I said, we've been kind of strategizing maybe a way forward with that.
All right.
All right, thanks.
Thank you.
Appreciate it.
Just curious, are you want to work with a county president?
No, I'm going to work for actually Lowe's corporate office down in Charlotte. Private sector. Right now. I've been working in government my whole career. Thanks.
Okay, so there is, any questions from any board members on item 5, 8, of the reports? Excuse me, 6, 8, 3 of the reports. Seeing none, then the next board meeting will be back in the chambers on the 17th. And I haven't, this is, we're gonna move that other meeting on.
Yes.
So there was the presentation that happened at the April meeting that we were gonna have. They weren't quite ready to have it this July, so we had to support. So they're planning in August to have that, administrative meeting by the end. So, okay. With that, yes,
Board member comments, please.
please.
We were talking earlier, about the whole idea, now that it's approaching summer in, and the fact that one of public health's greatest achievements, if not the greatest, is clean drinking water. The fact that many individuals in our community purchase bottled water, which is extremely expensive. I heard some comes out to like $17 a gallon or something. I mean, it might not be that much, but when I'm in the grocery store and seeing individuals like these huge bottled water containers, and I'm thinking, I just want to say to them, whoa, wait a minute, we have perfectly good drinking water from the tap. Wouldn't you rather spend that money on bottled water to provide other, essential food services and also save in terms of recycling the whole plastic concept? So I'm proposing that we think about a public health service announcement and maybe work with MUD to promote the fact that we have perfectly good water here in Omaha that we're already paying for in terms of utilities, but to encourage individuals to use the public water systems and not buy bottled water.
I would suggest, aren't you all of them, there's an action plan somewhere? I would bring it through there. So the way you're talking about this, the plastic thing, I would take the line and plan it.
Yeah.
And get more juice behind it. And see how that goes.
And one question, last question, with or food stamps, can they buy water on food stamps?
Yeah, just step down.
Okay, I'll ask, or, okay.
Yeah, I would bring that up and then see how. If you get added juice food there, it's other than, because the thing my thing while you're hearing that is, I don't quite know the situation why they be buying water, but I do know the thing with the plastic and stuff like that is a carbon, is a fine to deal with it. It's better to be able to.
If I can add my 5 cents to that, I think it's part of, again, educating our public in regards to that. Many of our people, immigrants, come from places that it's not safe to drink water out of the tap. So when they're here and they have that resource to buy water, they feel like they're providing a safety for their family. I think it's part of the department to educate the public that it is safe to drink the water.
That's the piece I'm going to walk out on. No, that's
I
the
think that
piece
would
I'm
be-
going to walk out on.
MUD would be a great source for us to say that. And they do run a lot of campaigns, and I know, in Mexico, that they provide videos and different medias that these are the areas where there is safe drinking tap water. These are not the areas where, and so I don't see where we cannot do that of providing education that we do have safe drinking water.
Maybe I'll talk to the city and we could I'll bring it up with the kind of action plan group, but
No, I would bring up the goal. And this is, bring up the UD. Is a good way to do it, and bring it up through climate action plan, because what I meant to, so Celine's point is, and just forgive me, because I am very sensitive to this. So because there was a guy at the board who made a very just asinine comment. And you equivocated anybody that was formed in Costco shopping to being like undocumented. And what I'm scared of is you get to talking about this in that frame of view. And somebody in this political economy takes this comment and goes to immigration and refugee stuff. So that's what I'm saying.
I totally understand that, but I am speaking from a personal experience.
Yeah, no, I agree, but I'm just saying, that's where my head is, and that's something to put out there now, and playing to it. Because you got a guy coming to the board and you're talking about Muslim and stuff like that, so I'm just saying, take it through a different track, so you don't get caught.
I think we could have a collaborative, general, hey, our drinking water is safe. Kind of.
It is general use, I'm not
or-
saying that only immigrants, that we are the only ones drinking or buying the bottled water, everybody.
I bought a
Exactly.
case last week to put in my storm shelter.
Well, that's
But
acceptable.
but I think, you know, we can probably hit the issue from a couple of different angles, so, working with other community leaders, maybe to have a collaborative message that's not focused to anyone other than, hey, we've got great drinking water here. But then, you know, we have our community health workers, we have people who work with our refugees. We have, I think, a number of health promotion people that might be great in having some more targeted communication to the groups that we might be most concerned about.
And part of the education that they provide is not only we have safe water, but where do we go and get safe water? They have a lot of stations in different areas where family meet, that they can go in and take their own containers and fill them up versus going and buying. So I think Omaha needs to work on a lot of that, especially in public parks and recreation areas, or areas where family meet, where they can have those shops where they can fill up large containers.
I think we see a partner.
Yeah.
Oh, look at that.
Go raise beds out of recycled plastic and put it back on.
Any other comments? All right, the motion is adjourned. Second by Wilker, and roll call.
So the motion was by Weiss.
Yes.
Okay. Wade,
Yes.
McNally, Hughes, Jones, Rogers.
Yes.
Espinoza.
Yes.
Thank you.
Thank you.
So that's it.
All right.
Yeah. Yeah, it's all we drink today.
Well, we can have this.
Keep you